Hello and welcome to the 48th Annual AAKP National Patient Meeting, Transforming American Kidney Health Patients Take the Lead. My name is Bruce Tippets, and I'm a kidney transplant recipient from Utah. After being on dialysis for 4.5 years, I was blessed to receive a kidney transplant on October 18th at the University of Utah Hospital in Salt Lake City. I have the honor of serving as the AAKP Ambassador. Being an AAKP Ambassador has allowed the opportunity for me to help pass the Living Donor Protection Act in the state of Utah in 2020. As a member of AAKP, I share the message that every kidney patient has the most important voice in determining their care plan. It is imperative that an environment is created that supports kidney disease research and innovations so that we are continually advancing care, improving treatments, and providing solutions for unmet patient needs. And when those innovations are FDA approved, it is crucial that all patients have access and the right to choose the treatment that is best for them in consultation with the doctor they choose to care for them, so every patient can live their best life and achieve their aspirations. As a reporter for myself for UBMedia.biz, I was excited to be offered the opportunity to introduce our next session titled On the Record Top Tips for Talking to Reporters. Since 2020, AAKP has dedicated to bringing you a variety of training sessions that provide practical skills that you can use to make an impact. To date, AAKP has over a dozen skills training sessions that support the activities and innovations under the Center for Patient Engagement and Advocacy and Center for Patient Research and Education. Today, we are honored to have our good friend Brendan Lacivita join us today. As a former Director of Communications at the U.S. Department of Homeland Security Office of the Secretary and former Press Secretary at the U.S. Office of Personnel Management, Brendan has a long history of federal government communications and advocacy. For 4 presidential administrations, he provided strategical media engagement, stakeholder outreach, and human capital management to the Secretary of Homeland Security and the Director of the Office of Personnel Management. It is a pleasure to have you with us, Brendan. The floor is yours.
Thank you, Bruce, and thank you, AAKP, for having me. My name is Brendan Lacivita. I'm a former press secretary for the U.S. Department of Homeland Security and the U.S. Office of Personnel Management. Today, we're going to learn how to work with reporters in coordination with AAKP. First, we're going to discuss how to talk to reporters. We can group this with 2 scenarios. The first one is AAKP-initiated media calls, where you're playing the role as a contributing patient expert, and then how to respond if media calls you. First, you're going to want to ask AAKP for the context of your role and the purpose of the interview. Are you increasing public awareness of an issue, cause, or government agency action? Are you correcting public misperception of an issue, cause, or government agency action? Or are you introducing a new idea or issue? Once you've determined the need, you're going to figure out the type of media that you want. Are you going to go with traditional media, such as TV, radio, newspapers, and publications, or new media, like digital, social, and the internet? AAKP targets different audiences. Who is the target audience, and how will your story resonate? Is it the general public that you're targeting, or specific stakeholders, such as government officials, allied organizations, donors, or researchers? Once you've identified the type of media, you have to figure out the type of attribution. Will it be background, on the record, or off the record? And you'll want to do that in advance of talking to a reporter. Background, we'll define that first. It's the source of the information, provides it to the reporter with the understanding they can use it, but cannot attribute it to the source by name or quote. It's also known as not for attribution. On the record, the source of the information provides it to a reporter with the understanding they may use it and attribute it to the source by name or quote. This is also known as for attribution. Off the record, The source of the information provides it to the reporter with the understanding they may not use it, but if used, the reporter agrees not to attribute it to the source by name or quote. Slide 7, the previous slides, are critical to AAKP in both pitching and responding to a reporter because it sets the framework of the interview and sets boundaries and limitations agreed to between the reporter and the source of the information. Next, we'll figure out how AAKP will identify the types of reporters that we're targeting based on the type of media desired. Will the reporter work for traditional media such as TV, radio, newspapers, and publications, or will they be a new media reporter, those with digital, social, and internet? So for an overview, once the need is determined for the information that you have, you target the audience, you figure out the appropriate media, you determine the appropriate attribution you'd like, and then you identify a reporter. Then you contact the reporter by phone or email. You pitch, sell the idea, the issue, the cause, or the relevant patient that you'd like covered. You agree on the type of attribution with the reporter, and then you provide the information on that idea, issue, cause, or person. During the interview, you answer any questions the reporter may have. Preparation for possible reporter questions should be made at initial stage of information development, so that's part of your prep work for the interview. Once you've completed the interview and have answered all the questions of the reporter, you ask for a publication or an air date. And then you provide the reporter with any necessary follow-up before the publication or the air date. This is the second component of talking to reporters, and this is responding to a reporter inquiry. So the first part was pitching, and this is responding to a reporter inquiry. When responding to a reporter, it can occur in a controlled environment, such as a prearranged AAKP interview, or a AAKP press event, or a media availability. Or it can occur in an uncontrolled environment, like a scene of action, a scene of disaster, or an emergency. In a controlled environment, there is preparation time for providing information, and you can provide follow-ups as necessary. But anytime you can't answer a reporter's question, you need to always be honest and direct. You can use things like, I cannot answer that question right now. I don't have that information just yet. That is not something I can address. Let me talk to AAKP and coordinate. They will get back to you as soon as they can with helpful information. In an uncontrolled environment, there is no preparation time for providing information. You have to think on your toes, but you do control the outcome. Do not be afraid to be honest and direct, once again, if unable to answer reporter questions. And if that happens, invoke the same responses I provided as in a controlled environment. For any help, please contact AAKP. Jennifer Raitt, Director of Communication and Digital Operations, or myself. Again, I'd like to thank you for this opportunity to talk with you, and enjoy your day.
Thank you, Brendan, for an excellent presentation. The tips and insight you share are top-notch and reporter approved. The training session will be added to AAKP's suite of all training sessions located on the AAKP YouTube channel. Visit bit.ly/AAKP on demand to access all of them.